bill is going to be is going to take a few years, right? So that's the conversation. It's going to take a few years for the bill to officially be rolled out. But the fact that it is signed into law is the conversation we're having today. How does the medical practitioners in South Africa really feel about this law? Are they for it? Are they against it? Are they supporting it? Or are they thinking, what is going on? Well, joining me right now to answer some of these questions is the spokesperson for the SA Health Professionals Collaboration, Casey Makhubele, that joins us right now via Zoom. We are live on Facebook as well, so go ahead and check it out. Casey, firstly, good afternoon to you. Thank you for taking the time out and joining me this afternoon.
Afternoon and good afternoon to your listeners. Ek het gedink dat ons sal hierdie interview in Afrikaans doen. I'm just kidding. My Afrikaans is baie swak.
You know what, for a moment you made me a bit nervous there. For a moment I'm thinking, nou moet ons regtig hierdie hele onderhoud in Afrikaans doen. But I'm so glad. Right, so Casey, I mean, as the South Africa Health Professionals Collaboration, when it comes to this bill, where do you stand?
Right. I think we need to make it very clear. Number one is that as the collaboration, we support universal health care coverage. In other words, we support an ideal situation where every citizen of the country has got access to quality health care in the country. However, it is the modality that has been presented and that has been suggested by government when it comes to the NHI that we do not support, because as it stands at the moment, I'm sure you will have read as well, there's quite a lot of issues around the NHI bill. So we don't support the bill as it stands.
Okay. So this bill, according to government, will take about 3 years. I think they said about 4 years, essentially, to completely roll it out, because there's a whole host of other things that need to be implemented within 4 years' time. Let's assume it gets rolled out and officially it gets put into effect in 4 years' time. Do you think that even then South Africa would be ready for universal healthcare at that point?
Well, let me actually start by making a comment on a statement you made when you said that everyone now can just walk into a hospital and you'll get treatment for free. That is not entirely correct. We still have to wait for certain processes of government to actually enable this this act now as it is, for us to be able to do that. So from the day that the president signed the bill into law, it does not mean that everyone can walk into the hospital and get coverage immediately. But with your question about 4 years, absolutely not. The NHI bill as it stands at the moment, we will not be ready. And in my assessment, it will not even be ready in 10 years. And the reason why I say this is that we just have to learn from the outside world, where many countries that have got a better economic growth than South Africa have not yet even been able to entirely and fully have a functional NHI bill the way we envisage it. Our one is even better than the NHI or NHS, or should I say NHI equivalent in the UK. And the UK, which has got a better economic coverage and economic growth as it stands at the moment, is struggling to implement such an NHS. So I don't see South Africa being able to implement this fully, unless if a miracle were to happen from tomorrow and we grow at a rate of about 7 to maybe 15% per annum, and then maybe we can talk about 10 years.
Okay, so then, with all of that said, right, despite what you've shared, and the government still decides to go ahead, implement it. The health minister Joe Phala is advocating for it, saying it's gonna work. It's exactly what we need as South Africans. They are implementing a whole host of things, so it's definitely going to work. How would this affect the private sector and more so medical doctors within South Africa?
Well, let's first look at the fact that the bill does not even start to define what it's going to cover. If you've got a medical aid at the moment, you know exactly what your medical aid covers
Yes.
and what it excludes.
Mm-hmm.
This bill does not tell you what it covers.
Okay.
Okay. So how it's going to affect the private sector? Number one, we are of the belief that it's gonna be the status quo for a while
Mm-hmm.
until number one, the NHI defines what it's going to cover, and when it starts defining what it will cover, the medical aid will then the provision of the medical aid where it says medical aid can only provide what is not covered by the NHI
Yeah.
will kick in then. So
Mm.
up until then, your medical aid will remain exactly as it is.
Correct.
And in my mind, the coverage of the NHI bill will not be as great or will not be as pervasive or will not be as broad at the beginning. It will probably be small, which means your medical aid at about 90 to 99% will remain the same for quite a long while.
Mm.
The only issue that you have is that because of lack of clarity, it is affecting some doctors, for instance. I mean, you've seen the surveys that are going around. Many doctors are saying that they don't want to see the situation that their counterparts in the likes of the UK are experiencing with NHS. They want to immigrate the country. Now,
Yeah.
if they were to immigrate from South Africa, that is going to exacerbate the already strained health care that we have, in that we don't have enough doctors to patients in South Africa, and you don't want to lose anyone anymore. So if that were to happen, that will put a strain on the whole system as it is.
Well, Casey, this is what you were saying, but the Minister of Health, Joe Pala, has stated that the healthcare under the NHI bill will improve under this new law, under this new bill. What do you have to say about this comment around that?
Well, I'm going to use an example from where I come from. So I'm a chief executive officer of the South African Dental Association in my other work.
Mm-hmm.
As it is at the moment, I can say to 87% of the dentists are outside of the public sector, and only about 13% are in the public sector. Now, if you don't have a working collaboration with the majority of the people that are supposed to give you primary health care,
Yeah.
how do you then make it to improve? I've worked out in the dental space that if we were to look at the situation as it is at the moment, it will take you and I close to about 3 years to see our dentists.
Sure.
So I hear what Dr. Patla is saying, and by the way, we are talking to him, and we share the same sentiments in terms of the wish to improve the healthcare of every citizen in South Africa. But currently, with the bill as it stands, currently with the issues that we have associated with the bill, it will not improve tomorrow. It will not improve in 4 years. It will not improve in 10 years.
Yeah.
We need to do more to actually change that. So we share the sentiments. We share the dreams that he's got, but we don't believe that as it stands at the moment, and with no money available economically, that we can actually improve the status quo of our people as it stands.
Casey, thank you so much for your time. Thank you for chatting to us about the NHI bill. Now, I do know that obviously there's a lot of objections to the bill at the moment. There's a few political parties and a few other organizations that is going to be taking this to court, and a whole host of things happening in the coming weeks and months, given that the bill has now been signed into law. So hopefully soon we get to chat more about this as the story continues to develop.
Thank you so much. And we were impressed that the president in the past 2 days has now indicated that he is willing to actually speak to the private sector in particular to see if they can give more input on how this bill can be rolled. I believe that if he goes there with a good listening heart, he will definitely find that they are ready, and we may just be able to improve on the bill. But thank you so much for your time.
Thank you for your time. And, just closing out on that comment, he should have gone there in the first place. But Casey, thank you so much for your time. We'll chat soon.
God bless.